we're here to celebrate the launch of the Peking University China Medical Board Lancet China series. 19 papers, 7 a theme, 12 commentaries, but they're 2 lovely profiles. Also, a lead editorial and even a book review. Together, they have examined China and global health in the 21st century. The individual papers seek intellectual scientific excellence with relevance. But it is the papers together where the whole is greater than the individual parts. Because as a series, the daunting health challenges faced by China are presented, the rapidly changing and agile health strategies that are being adopted are examined, and of course, the future of the health of the Chinese people are projected and examined. The journey has been 2 years, 63 scientists, 2/3 Chinese. Most of the scientific contributors are here, and I want to pay respect and homage to your very hard and good work. You have invested enormously your talent and your time for this series. I want to also acknowledge the leadership demonstrated by Professor Deng Ze, Professor Michael Phillips, and Dr. Bill Summerskill, because the Peking University China Medical Board and the Lancet have formed a partnership. I think I concluded that indeed Peking University is China's leading university. Indeed, it may be among the world's leading universities. And I have also concluded, after witnessing the Lancet peer review process, fact-checking, editorial reviews, rewriting, and examination, I understand why the Lancet is the world's premier medical journal. The China Medical Board is very proud to be part of this joint project. 94 years ago, we began work in China with one mission, and that was to introduce modern medical sciences in China through the establishment of Shepa. For 30 years, we have worked to strengthen a dozen medical universities throughout China in cooperation with the ministries of health and education. Now, we look forward, as China does, into the 21st century. China is not what it was 94 years ago. China is a strong global power in the economy, and as the Lancet series, increasingly in global health, in science, and in application. The Peking Lancet collaboration is an early step into the 21st century for us. I want to thank you all for the opportunity for us to have been able to learn, to have contributed, however modestly, but also to have been able to participate in what Minister Chen said, the personal exchanges, because it is the human bond that builds communication, trust, and confidence that is the ultimate foundation for good science and good health. Thank you very much. I would like to invite now Lancet editor Richard Horton.
Distinguished ministers, friends, and colleagues. This report, a collaboration between over 60 scientists and public health experts, over 2/3 of whom are from China, signals that it is time to recognize China's critical but so far neglected influence in global health affairs. China has achieved incredible successes, not only economically and sadly by beating the United Kingdom very successfully in the recent Olympic Games, but also by lifting over 200 million people out of poverty in only a generation. A truly historic achievement in the history of the world. The leaders of China's health system have many challenging tasks ahead of them. They are seeing the country pass through a rapid epidemiological transition, changing the balance of disease priorities and health risks, sometimes dramatically so. Chronic diseases and injuries are now China's greatest health challenges. And the health gains that could be achieved if existing knowledge on, for example, smoking cessation, salt restriction, and the treatment of risk factors was implemented could be substantial, saving the lives of many millions of individuals. I want to stress that amid all these challenges, the conclusions of this report are optimistic. They're optimistic because the data and analyses that are presented are done so with great honesty. They connect evidence to policy, scientists to policymakers. Collaborations and inside and outside China are flourishing. And the links between the health and the non-health sectors, education, agriculture, urban design are becoming ever more clear. It's important for me to remember that the Lancet was founded in 1823, and its objective then, as now, was to bring science to bear on improving society. That goal still remains our hope. It's at the core of all we do, but at a different time, 185 years later, and here today in a very different place in China. We thank you, and we look forward to a long and fruitful collaboration in coming years. Thank you again.